to the morning show.
Welcome back. COVID is taking a toll on our kids now. New data shows children are testing positive for COVID-19 at levels we haven't seen since last winter's surge. So to break it all down with us, this pediatric surge that is, I'm joined by Dr. Rosha McCoy, and she's Senior Director for Advancing Clinical Leadership and Quality at the Association of American Medical Colleges. Thank you for joining us, Dr. McCoy.
Thanks for having me.
All right, so let's begin first. A headline like I just read that we saw yesterday can be really scary for parents, especially parents who have children with underlying medical conditions or other medical concerns. So what are we seeing in American hospitals right now? Who are these pediatric cases? Are they very young children, school age? Can you give us some insight?
Sure. I mean, we are seeing an increasing number of children getting hospitalized with COVID-19. Mainly because they are the population that are one of the groups of people who are not vaccinated. So yes, it is following a similar pattern to what we've seen in adults, where children with special health conditions, children who are immunocompromised, are much more likely to get hospitalized and get seriously ill. It does still seem to be, although we do hear some cases of very young children getting sick, it is still more in the school age group. Children who are associating with other children more and are out in public more. So it is a similar pattern. I mean, I do think we need to do everything we can to protect kids, especially kids with special health conditions. And the best thing we can do is to make sure everyone around them who's eligible to be vaccinated gets vaccinated. It's really called cocooning. As we do this with other conditions, like when young babies can't be vaccinated for certain things, we ask the entire family to be vaccinated. So it's a similar pattern that we've followed with other infectious diseases. So it's very important for everyone who's eligible to be vaccinated so we can protect our kids.
Yeah, I remember when I had my daughter, they made me get the whooping cough vaccine. So that's something that parents are a little familiar with. How big is the Delta variant? How big of a concern is the Delta variant as these kids are heading back to school?
Well, it is somewhat of a newer challenge because the Delta variant is so much more transmissible. So we know that it's much easier to pass the Delta variant on to other people because there seems to be much more virus circulating around when particularly in someone who's unvaccinated. So just need to be much more careful with all the infection control measures that we've been talking about for the last year and a half. We need to make sure people are masking. We need to make sure that people are maintaining some social distance, smaller group classes, more ventilation, all the things that we've been talking about, trying to do things outdoors if they can. So all the things we've learned together over the last year and a half, we need to apply. But in addition, I want to emphasize again, now we have the additional protection of eligible people being able to be vaccinated. So there needs to be a great deal of focus on all of these measures, particularly on vaccination and masking.
And then for families who have been diligent, right? So the parents that have gotten vaccinated and have been really careful throughout the entire pandemic. I know I'm seeing it a lot on groups online because I'm really connected in our local community with what people are talking about online. And they're saying that one of the things that's concerning to them is that they're seeing that kids are maskless outside. And I know that this, for families who have lived, under strict measures, that's a little concerning to them. Now, how big of a threat is outdoor play right now for our kids if they are going maskless?
Yeah, I mean, I think outdoor play in small groups is not that risky. We just need to be mindful of going into large groups of people, large groups of unvaccinated people, close contact. So I would say if someone wants to be extra careful, it's perfectly fine to go ahead and have their child masked even when they're outside. But if they're on a playground and there are, not very many children close by, then they don't need to keep masking. So I think it's just using common sense. It is still a risk. It's much less outside than it is indoors. So people just need to use common sense in large groups, etc.
Yeah. Okay. All right. And one last question is next up is the COVID vaccine for our children under 12. Can you give us an update on that? What are we looking at for a time frame if parents are really, not excited, but looking forward to that?
Yeah, I mean, we don't know an exact time frame. We've been told late fall to early winter. It'll probably get authorized first in the 5 to 12 age group. Typically, that's how this works. And then for maybe 2 to 5 and then under 2 is usually how these authorizations work, but we can't totally predict that. So that's what we think will happen. And so it'll probably be early winter before the 5 to 12 age group is authorized. But again, FDA has to follow all their processes and continue to carefully study all the long-term data that they have. So I'm confident that they'll do that, and the vaccines will be very safe for children, just as they have been for adults. But we do need to wait through that process.
Yeah, especially because it is our children. And then,
Right.
the Pfizer vaccine got the full FDA approval this week. Does that mean that when it's approved for children that it'll be full FDA approval, or we have to go back to emergency use? I don't know.
Yeah, it'll probably be emergency use first, and then get long-term data like we have for full approval. So it'll be emergency use first for children under the age of 12, and then go through the same processes they do for full approval.
Awesome. Okay. Yeah, just one of those questions, that's kind of being left unanswered. So thank you for getting to the bottom of that. All right. And we certainly appreciate you joining us this morning. Thank you for your time.
Thank you so much. I appreciate it.
And we'll be right back.